I mean, we can make political arguments for why we should use homeopathy. For example, a cost savings that would be involved. The homeopathic medicines are very inexpensive compared to conventional treatments. They're just absolutely inexpensive, actually. And they're effective. But we also have to, so we help individuals enormously. You know, people who can find their way to be treated homeopathically do better. It's always a very heartbreaking situation. You know, I'm a physician and a professor, but I'm also, you know, just a person. I have other social contacts and whatnot, and you hear about people who are suffering with an illness or this and that, and you know that homeopathy would at least be an option that might be able to help them, and they're, because of the cultural dichotomous thinking that we have, and either, you know, alternative medicine is either good or bad. It's not something to consider. They don't avail themselves of something that could really, really help them. It's heartbreaking sometimes. Yeah. So we help a lot of people, but we also help society. When you can treat people and make them healthier, especially as we do with homeopathy as whole people, the health of the society gets better. People start treating each other better. We take a mother or a parent, let's say, who is irritable and angry with their children, and because of a sort of, I guess you could call it a kind of depression, let's say, and you treat them homeopathically and they become happier, well, their kids become happier too, and then the kids that interact with that child, also there's a ripple effect there, and the whole society gets better. So there's a more of a meta benefit to homeopathy, because it heals people from the inside out. It makes people healthier. It makes, and Hahnemann in the Organon of Medicine, which is the founding book, I like to think of it as like the owner's manual, you know, the computer manual for homeopathy, mentions that real health, when we achieve real health, ultimate health, it's not just an absence of disease, but it's ability to use what we have been granted as a living organism, a living human being, to reach the higher potential that we are here for. And we see that happen all the time. I have a patient, for example, who has a number of diagnoses, unfortunately. He came to us very late. He's in his 60s. He has history of prostate cancer. He has had very serious depression. He was diagnosed late with multiple sclerosis. He has a genetic problem that causes him to have clots. And so he has a whole bunch of things, but when he gets sicker, he just sits around and mopes, and when we give him homeopathic treatment, in those times when he relapses, what he comes in and tells us, the first thing he tells us is, I can play my music now. I get out my guitar and I can writing songs. He's a musician. What I couldn't do when I wasn't feeling well, when I was sick. So there's more to health than just the fact that when he gets a multiple sclerosis flare and he gets optic neuritis and pain in his eye and his head, and when we give him homeopathic treatment and it goes away, that's wonderful, for sure. But there's also this other piece where we're making people healthier and doing what they need to be doing. Of course, we're not the judge of what any particular individual is here for and what they need to be doing, but it seems like their own organism and connection to whatever knows, and that occurs. And that's not a minority of times. That happens frequently, that people come back. And people will often say to us, especially when we're treating chronic disease, they'll say to us, I feel more like myself. We hear that frequently. So that somehow we've taken away this overlay of disease. If you don't mind handing me one of those little, those white things right there. No, all the way over. That, yeah, don't fall out of the chair. Get up, don't worry, you got plenty of tape. Yeah, but I need the yellow one. Yeah, give me the yellow one. Just give me them all. Okay. So you know, we look at people who are sick and we think, oh, you have this illness, okay? And I remember reading in a book by a wonderful physician, Rachel Noemi Remen, that I read years ago, called The Human Patient. She said, what about this idea if we, instead of calling diseases with nouns, you have diabetes, you have multiple sclerosis, you have this or that, depression. What if we use verbs? What if you're multiple sclerosing right now? It doesn't have quite the stability, right? So we sometimes think that the disease is like an overlay of the patient, over the patient. And then you look at the patient and you say, oh my God, he looks yellow. Yeah, but when we take away the disease, what Hahnemann called the untunement of the vital force, the dysfunction or lack of adaptability at the level of the person as a whole, all of a sudden things that people thought were them, you know, like maybe yellow is I'm irritable because the last 40 years I've been irritable. I snap at everybody. You ask me something, I take it the wrong way. Okay, I think that's me. But when that goes away, all of a sudden it's not me. Here I am without this overlay, and the patient intuitively understands that, and they will say this, I feel more like myself, because that part of me was not me. Wasn't the real me. The real me is the healthy me. You can't engage in personal development if you're not well. You know, Abraham Maslow had this hierarchy of needs, he called it. When people are at the bottom of that scale, if they're starving, or you know, they don't have shelter, or they're not well, they can't attend to those higher needs that we have, or purposes we have as human beings. When we take care of all of that and now you're healthy, now you can start to do those things. Now you can start to tend to those things. Absolutely. It's a helpful way for people who are interested in personal development. Because illness doesn't affect just the physical body, it affects the whole person. I think the problem with this kind of political debate is a problem of self-awareness and scientific rigor. Most anti-homeopathy folks are unaware that we as human beings can easily believe anything. I was just reading a study that it's neurologically much easier to believe something than to not believe it. Hahnemann talks in the very little article he wrote, so it's a couple of pages, called The Medical Observer, that being self-aware, self-critical of our belief structures about, in his case he's talking about patients, but in general, is not a natural human tendency to be aware, to be self-critical. And he encourages us to be that way, to think. A lot of the anti-homeopathy folks who are fighting, evidently, like you're saying in England, to get it, they're not aware of their own biases. They think that they're right and other people are wrong, and they can't understand. So they don't even, like I said earlier, they don't even actually look at the research that's there, because it would break their paradigm. The psychologists call that cognitive dissonance, and they have a lot of problem with that cognitive dissonance, because homeopathy it actually does something. It throws a lot of it throws them into a situation where they think a lot of what else they believe is not true. And that's problematic for them cognitively. And what we human beings do when we're most of the time confronted with absolute evidence that what we believe is not true is to retreat further into our beliefs. This is a human tendency. It takes a real special person like Hahnemann to be able to say, no, I was wrong. My beliefs were wrong. I'm going to be open-minded and look and see something else, something different. I'm going to actually look at it. You know, one of the most important homeopaths that we have ever had, Constantine Herring, who was the founder of homeopathy in America. And I mentioned, founded the Allentown Academy and the Hahnemann Medical School in Philadelphia in the 1830s, was given the task as a graduate medical student by his professor to write a negative article about homeopathy, because the forerunners of the drug companies back then, the Apothecary Guild, were getting upset because homeopathy, the homeopathic medicines were cheap and they weren't making a lot of money, I think. And so Herring just read about it and decided to investigate. He was going to write this article. He was, would have been quite famous in his little subculture, I'm sure. So he went to see Hahnemann, who was then in semi-retirement in southeastern Germany, and started to see the patients and learn more and more. He never wrote the article and converted himself to homeopathy, but he's unusual. He's an open-minded guy, right? This is part of the problem we have. There may be more, financial issues involved. I mean, certainly is every patient who buys a homeopathic medicine is probably not buying a more expensive allopathic medicine. So there may be some of that, but I think a lot of it is just self-awareness and consciousness. The idea behind Herring's laws are that when you see cure, that it comes from above down, from within out, from most important organs to least important organs, in the reverse order of occurrence. This is just an observation that Hahnemann had. I've certainly seen cases where disease, I saw skin rashes come down the body and go out. Come here, go away here, come out here, go away here, come out here, go away here, come out here, until it's gone. So you see that. But I've also seen skin rashes go the other way and cure just as well. It is true that oftentimes when people are healing, things that they thought they were done with long ago, because of allopathic treatment or whatever, come back in the course of the healing. Okay, so that last one, the reverse order of cure, has more clinical importance. We see this, for example, this is very important when we're treating psychological states of maybe depression or eating disorders or something in a woman who, for example, was sexually traumatized as a child and maybe has gone through 10 years of therapy and says, I'm done with that. And we give them homeopathic medicine and they start getting better, and some of those memories come up. We have to warn patients, in fact, be careful, because it needs to be the right time, because some of the stuff you thought you were done with comes back. Sometimes people, little kids' rashes come back. We have a kid right now that we're treating with very, very, very severe asthma, who has been in and out of the hospital numerous times and is doing much, much better. The asthma is completely gone at this point, actually. But now they came in, well, we're concerned. He has this rash. Well, did you ever have that rash before? Oh, yes, when he was a little baby, and we put a lot of steroids on it and it went away. Okay, guess what? That's going to come back, and we need to be patient with that, and that will go away too. And we'll manage that, but that's part of that reverse process. As they get to a healthier state, then some of these things can come up.